This weekend, the American Society of Plastic Surgeons will host its annual scientific meeting in Toronto. Over 5,000 doctors, medical personnel, and industry professionals are expected to attend.
With techniques improving and prices dropping, plastic surgery is no longer limited to a wealthy clientele. Regular people from all walks of life are now embracing the procedure as they attempt to fight off the aging process.
Dr. Frank Lista is a highly accomplished Toronto plastic surgeon who has introduced many new surgical procedures. He joins us now from our studio in Toronto. Doctor, what's the biggest change that you've seen in plastic surgery since you began working in the field?
Well, I've been a plastic surgeon for 25 years, which is a long time, I guess, but I think your introduction captured it. When I first started, plastic surgery was for rich people, and now it's commonplace. It's an operation. There are operations that regular people come to see us for.
What are some of the trends that most people are asking for right now?
Well, it's the trends in body parts are the trends of body parts that we've always been interested in. You know, and we divide them into two groups, right? People who want to change something that's always bothered them, like their nose, for example. And then there's people who say, you know, my body's changed, I've had kids, following pregnancy or giving having children, things have changed and they want their body parts put back to the way they used to be.
Doctor, I hear commercials on the radio, I've seen them on television now in the last couple of months. Men that have enlarged male breasts. There is a procedure for this. Are men becoming more interested in having their bodies altered? I'm assuming women are more interested, but are men catching up to women as far as wanting to look better and finding it affordable?
That's exactly true. Men are catching up to women in their interest in how they look. We wrote a paper discussing a new technique for exactly what you discussed, improving the appearance of breasts in men, which is interestingly a condition which is becoming more and more common. There's a lot of talk about why that is, but the most fascinating thing is that men are just as interested in looking good as women. The only thing is that they haven't talked about it as much. But I think men care.
I want you to expand a little bit on that surgery for men or young men, because it can be very embarrassing for a young boy or a young man who has developed breasts to be in public, to go swimming in that. And if there is help for them, I mean, how affordable is it? How dangerous is it?
Well, it's actually very safe. It's an operation that we do frequently, and we do several hundred of those operations a year. So as far as the safety goes, you know, it's always something to think about, but it's really not something that's dangerous. How affordable is it? You know, it depends. If it's done on a child and they have hormonal problems, could be covered by OHIP. Most of our patients are adults, in which it's not. And, you know, it's not that expensive, and it's affordable for most people. And you're right, it's a really embarrassing situation. And, you know, it's really great to make people feel better. That's what plastic surgery is all about.
Doctor, can you help yourself sometime? If you see someone, for example, can you assess that person, not knowing them, and saying, well, those breasts are fake, or they've had work done, that type of a thing? Is it as easy to point out someone has had work done now as it was before, or is it?
Well, that's interesting. And I mean, what we talked about at our meeting on the weekend, and what, you know, all these American plastic surgeons and Canadians are looking at, is making plastic surgery look undetectable. So of course you see the bad cases of breasts or bad faces or bad noses, but what we're really trying to do now is make plastic surgery look natural, so that no one knows that you've had anything done, so it looks like you were born with it. And we can achieve those results. That's really what we're pushing for, what our research is directed towards.
But I want to challenge you in one area that I think is really common, and it's women my age who get what I describe as the Ronald McDonald look, and it's this filler in their face, and it gets puffy, and it's almost a mask that we're seeing on so many celebrities and on an awful lot of women, and I'll say they're usually quite wealthy women in their 40s and 50s, and it doesn't look natural.
Well, you know, you're right. And the answer to that is that anything can be done incorrectly. You know, you can have your kitchen redone and it looks like a mess. And, you know, for every bad case that you describe, and I see them too, and it makes me cringe, there's hundreds of patients who are absolutely undetectable. And so the answer is you need to talk about it with your surgeon. First of all, you need to go to a qualified plastic surgery, because you know, you need to make sure that the qualifications of the person you go to are what you want.
Cheap isn't always better.
Cheap isn't always better.
Let's talk about the costs. What do you think is the most cost-effective procedure right now for people who just want to trim a few years off their face? Is it Botox, which really isn't plastic surgery, but...
It's not really plastic surgery, but the fillers that fill fine lines and wrinkles, like Juvederm and Restylane and fillers like that, and Botox are probably the easiest things that you can do without surgery. The most important thing, though, is we tell people, take care of your face. Go find a good skincare line that takes care of your skin and protect your skin from the sun. And, you know, there are things that you can do to make your skin look better without having surgery. So the most cost-effective thing is take care of your skin, and the second most cost-effective things are the non-surgical treatments.
And having said that, doctor, do plastic surgeons ever work hand in hand with dermatologists? Because I know that sometimes the dermatologist might be the most trusting of all the specialists when it comes to your skin and what's going to happen to it.
Yeah, well, you know, plastic surgeons have a lot of training in skin care, as do dermatologists. And, you know, a good plastic surgeon will work with a dermatologist, not necessarily in the same office, but I'm frequently sending patients to them for non-surgical treatments, and they're frequently sending patients to me and say, okay, this is what we've achieved with non-surgical treatments, and now it's time to see your plastic surgeon.
I want to ask you a little bit about risks. We don't have a lot of time, but we talked about Botox and these fillers. Can anybody apply them? Can anybody give them to you? Because a lot of nurses are now injecting the Botox. Is that something that should be restricted to a physician?
Well, I think you need to be careful. I mean, it's okay for nurses to do that, but the important thing is that it needs to be done under the supervision of a doctor. So I think that whenever anyone goes for a treatment like that, they need to see the doctor first. The doctor needs to be around. The nurse needs to discuss the care with the doctor, and I think the two need to work hand in hand. And, you know, if there's no medical specialist around, you know, I think you need to look somewhere else.
Dr. Frank Lista is a highly accomplished Toronto plastic surgeon. Thanks so much for joining us today and for enlightening us as to the possibilities when it comes to plastic surgery.
Thank you.
Thanks for having me. Thanks.